Hi, Dr. Chris Baker here. Today I've been thinking about patients and behavior management of child patients in the chair, orthodontic or not. It's kind of like some days in your practice it feels like it's Halloween with little monsters in the chair, right? Well, I'm going to talk to you today about some politically incorrect ways to manage children that parents love. The first thing I want to talk about is a little girl that we have in our practice in Abu Dhabi who has Charge syndrome. And she is a pretty good little girl. She's about 11 years old, but she's somewhat fearful and she's not used to having to cope with things. Partly because of all the medical procedures, perhaps, partly because she's been babied through them, partly because she has an older sister and she's the youngest. Who knows? The point is, she has problems coping in the chair. And so when we get her into the chair and look at her for her braces, she shows us that it's not going to be an easy thing to do. Not easy for her, not easy for us, not easy for mom. Mom tries really hard. She's very good. She wants the child to cope. She wants Amal to be okay. But unfortunately, she's not. So when we finally figure out what her needs are, here's what we did. Number one, we introduced mom and her to the Cuddle Coat. She's 11. She's a little 11. She probably looks about the size of an 8-year-old. And so, even so, we needed the large papoose, the Cuddle Coat, that covers the entire chair. If we put that on the chair, she gets very nervous about what that's about. She was nervous to start with. She says, no. Mommy, I told Mommy, this is what we can do. If you want her to be treated, we can do that. We can cuddle her up for safety, keep her safe, keep us safe. And if it works for you and you're okay with it, we'll do it. Mom said, please, I want her treated so badly. No one else is willing to even try. Please do that. I will not go to the operating room, and I want her to have orthodontics. So she has learned to come into the clinic and have the cuddle already on the chair. She climbs up on the chair, she lies down, and she waits while we cuddle her up. And guess what? We're about 3/4 of the way through her orthodontic treatment. And she's happy, and mom's happy. She cries here and there sometimes, but not much anymore. She's right there with us. Mom is thrilled. Mom is so grateful, so appreciative that her child's teeth that were what you might call wonky, that's what the British patients in my practice call them, they were all over the map. She looks fantastic. And here she is, happy and coping and having her treatment done in the Cuddle Coat, in the chair, and everything is great. That's one. That's something that we tend to discount. Oh, we can't use papoose. You can if you get a consent. You can if you explain it. You can if you get the parent on your side where they want their child treated, if they do. You can if you tell them it's to keep them safe. It is not a punitive measure. So the Cuddle Coat is one politically incorrect way to help a child get something wonderful done for their lives. Another thing is orthodontics, period. How many children want to have impressions? How many children want to have anything done? Guess what? When we get them through it and they have their teeth straightened, as the parent says, or when they have their orthodontics completed, when they have a phase 1 done because their incisors were very protrusive and they had already traumatized them twice, and all of a sudden they look great and they're less likely to traumatize them. How did we do that? With this child who was resisting all the way? Just by getting them through it, talking them through it, getting mom on board, having her sit right there beside you, giving them both love, telling them we're going to do it. I had one little patient, a little boy, Joseph. Joseph said no. And Dad looked at me and said, I don't know what to do. And I said, let me handle it. And Dad said, please. I said, Joseph, we're going to do this. Your teeth need to have this done. You need to have this done. Daddy wants you to have this done. We're going to do it today. No, said Joseph. I said, yes, we are. It's okay. We can do it. He's in the chair. We get a head support person, which means somebody sitting behind the chair on a little small stool giving his head support, and that keeps him safe. And I can go in there and fit bands on his teeth. I can make him a lingual arch, or I can put braces on his incisors. And the dad is thrilled. Did we spend an extra half hour, 45 minutes talking about it? Yes. You know what? It's amazing how many hours you spend trying to educate parents how to brush teeth, too. So it really is not a big deal to invest that kind of time in helping the parent and the child get through it. And when it starts out, you might think to yourself, that's politically incorrect. That's not something I want to do. But you know, when it's finished and you help the parent and you and the child all work together as a team and it gets done, you'll feel so proud. Your chest will be puffed out so big, and the child will be too. There are a lot of things we can do, and we can get ortho done on our special needs and even on our non-special needs children who have a difficult time in the chair. We talk about this in Element seminars here in East Texas. Come see us. Come join us. Dr. Chris, signing off.